Hi, this is Dr. Roger Moore, here to help answer the question, why should I get a skin cancer screening exam? Well, it's important for us to understand that 3.5 million people per year in the United States, in fact, up to 1 in 3 Americans will get a skin cancer at some point in their lifetime. So our lifetime risk is very high. In addition to this, each and every one of us, regardless of our skin type, our sun exposure, and our prior history, has some risk of developing skin cancer. So we have to know what to look for. It's important to understand the risk factors that each of us carry around with us on a daily basis and when you should come in for an evaluation. The risk factors for skin cancer really start with sun exposure. And this sun that we get throughout our life, even that occurs when we're young, can actually add up to being something that can cause damage to our skin and increase our risk of skin cancer later on in life. Some of the things we do in youth, such as tanning beds or laying out and getting too much sun, can actually play a role in increasing our risk of skin cancer, even if we've done these on just a limited amount. It's important also to understand that over 85% of your lifetime sun exposure actually occurs from what is termed incidental sun. This means driving in a car or walking to and from work outside for those short jaunts or to and from grocery stores. That amount of sun time actually adds up to 85% of that sun that you'll get over the course of your lifetime. So you have to be aware that not only are the sunburns important, but the small amount of sun. When we think about sunburns, we have to realize too that even a single sunburn at any point in your life can increase your risk of skin cancer later on. Now, as we transition over and look about our own personal skin type, we have to realize that if we tan very easily, we have a little bit more protection from the sun. But if you don't tan very easily and you're always getting a little bit of burn or blister whenever you go out in the sun, your risk is higher than the average person. Overall, sun is one of the key factors for leading to skin cancer. But you can't stop there. You have to realize that if you freckle in the sun or you have a little bit of an intolerance to the sun, your risk is higher than the average person. If you have fair skin, if you're very light complected, or you have blue eyes, light colored eyes, or blonde or red hair, you're considered a lighter phenotype. That means that you're more susceptible to having sun damage or skin cancer. If you live at high altitudes or you spend any time at high altitudes, your risk of skin cancer is higher. In addition to this, a prior history of a skin cancer, a melanoma, or any other abnormal growth being removed could be a risk factor for you having skin cancer. Your family history can even be important. That history of your parents or grandparents having a prior history of precancer, skin cancer, or melanoma should lead us to making sure that we're getting evaluated and we're taking care of our skin. If you've ever had precancer lesions, such as the actinic keratosis, these rough, scaly spots are very common with advancing age and with chronic sun exposure. They do increase your risk of having skin cancer. In addition, people who have a high number of moles or have ever had any moles removed, their risk of having either melanoma or skin cancer can be higher than the average person. If you have a weakened immune system because you've been on immunosuppressant medications, you've had exposure to radiation for treatment of acne or other conditions, and have ingested substances that can weaken your immune system or lead to skin cancer, such as arsenic, your risk might be higher. And there are definitely other skin risk factors for skin cancer that you should come in and discuss if you think you might have any of those. In addition, the risk factors for melanoma are very similar to what we find with skin cancer in general, the non-melanoma type. However, you have to be aware that if you have risk factors for melanoma, it would include having moles removed, or having a high number of moles. Melanoma is actually one of those conditions that can be very deadly if it's not caught early. So if you've ever had a melanoma or anyone in your family has had a history of melanoma, you should come in at least once a year for sure. In addition, if you've ever had a prior removal of an atypical mole, a skin cancer, or melanoma, your risk is going to be higher than the average person. So overall, please be aware that each and every one of us have an increased risk of skin cancer just because we have skin. And the sun exposure, our genotype, our phenotype, and what we've done to our skin throughout our life. It's important for us to make sure that we are on the lookout. You are your best advocate. You can help prevent skin cancer by coming in for an annual dermatologic skin cancer screening exam, and you want to be checked if you have anything that is new or changing. If you have a growth that's been present for more than a month, come on in, let us take a look at it and just make sure that it's okay. If we do this together, we can partner and actually improve our chances of catching early and beating out skin cancer. I wish you much success, peace, and happiness. Thank you.